The Ministry of Health announcing today that International Health Organizations has relabeled the novel coronavirus as COVID-19. And while concerns mount over the coronavirus, health officials here are also closely monitoring the flu season and its impact. The U.S.-based Centers for Disease Control estimates that over 20% of the American population will contract some form of influenza each year. But what's taking place here in the Bahamas? Anthony Smith takes a closer look.
For more than a month, headlines here in the Bahamas and around the world have been gripped by news of the novel coronavirus. But oblivious to most, there's another dangerous virus to look out for, and it's already here.
Absolutely, Bahamians should be more concerned about influenza.
The U.S.-based Centers for Disease Control estimates that over 20% of the American population will contract some form of influenza each year. That may be a huge cry from that of the population here in the Bahamas, but the question still applies. Just how much of a threat is it? We visited Deputy Chief Medical Officer Dr. DeLon Brennan to find out.
We see multiple cases every year. It gets into the hundreds, if not thousands of cases. And we see people who suffer not just, a runny nose, a cough, fever to go along with it, but we see people who get complications such as pneumonia from it. And unfortunately, some years we'll actually see some death.
According to Dr. Brennan, although the Bahamas public health system has seen quite a few cases of both influenza A and B this year, the country is experiencing a pretty average to moderate flu season. However, that does not mean persons should not be taking precaution, as the season is still very much active and some are more vulnerable than others.
What we need to do is ensure that within the populace we are giving, especially those groups that can get really bad complications, the vaccine. So young children, especially those between 6 months and 5 years, the elderly population, those with chronic non-communicable diseases.
Brennan says vaccines have been instrumental in keeping influenza numbers at bay over the years. However, the uptake rate in the Bahamas continues to remain extremely low. He says, however, the health system remains on guard.
In both the public sector and the private sector, whether that's in hospital and or in our community clinic settings, we're seeing more testing getting done. So we can definitively say that this is influenza A or influenza B or not influenza at all.
Anthony Smith, ZNS Network News.